First item on the agenda is we have a roll call.
Sure. Commissioner Ruby,
Here.
Commissioner Pinna,
Here.
Commissioner Houston,
Here.
Commissioner Chamberlain.
Here. All right, next on our agenda is public comment. The guidelines for public comments allow anyone to speak for 3 minutes, so. I have a list here, but there's only 3 people on it, but I guess I can go in order. Rebecca Otto from Emmett County.
Hello, everyone. Yes, my name is Rebecca Otto, and I'm from United Way of Northwest Michigan. And I'm here to announce that on behalf of United Way, we've received the $500,000 grant from the Michigan Health Endowment Fund for whole child nutrition. And I wanted to take this time, forgive me, you've already heard this comment at your commissioner meeting, but I wanted to point out that scrambling to submit this grant was not in my work plan this spring, and this work is too important to lose. The Health Department of Northwest Michigan and groundwork staff worked hard for 2 years getting this grant ready, and United Way wanted to make sure that their dedicated effort still served our community. We had the capacity to be the last leg of this relay race and fully live up to our mission of connecting and mobilizing the caring power of our local communities to advance the common good. I hope, however, that the governing bodies that you serve on still continue to pursue funding sources that experienced and capable staff bring forward to you. Nonprofit workers are exhausted, and while we have learned to expertly pivot, it is not the best use of our time.
Next, I have John Swartout, Emmett County.
John Swartout, Emmett County. This grant you're considering today is from the CareQuest Institute. I've had all of about 20 minutes to research this today. I don't like the CareQuest Institute. It is supported by the Proteus Fund, which is part of the Tides Foundation, which is George Soros' network of nonprofits that promotes their woke agenda. Our CareQuest endorses this statement on their website. There is no shortage of work to be done to fix our healthcare system and achieve one that recognizes that healthcare is a fundamental human right. Healthcare is not a fundamental human right. To have a right, it assumes that, to provide healthcare to people, that assumes that somebody's got to pay for it. Is the healthcare worker supposed to do it for free? This is socialism. That's all we're talking about here. Now, is this a good grant for the Health Department of Northwest Michigan? It might be. I don't question the health department's ambition to provide services to underserved people. But my problem is that I care about people. And what's good for people is free markets, free people, limited government, and all of this web of grants and purporting to serve the underserved. It's racist on its face. They say, well, we want to serve women and people of color because they're disadvantaged. Well, that's an undemocratic way of judging people. So I don't know what to tell you about this. I dislike the source of the money, but if it's free money and it will help people, then God bless you. Go for it. But you're part of a system that is undermining what America stands for.
Greg Bentley, Charlotte County.
Hi, my name is Greg Bentley, and I'm a taxpayer here in Charlevoix County. And I think what I wanted to talk about today was feeding the beast. We've got a health department in the state of Michigan that is overfed and bloated. I'm sure a lot of you still haven't refreshed in your memory what happened during the COVID agenda, starting in 2020. But the state of Michigan had been given grants from the CDC. You actually go to their website, totaling over $132 million. If you went to the average citizen in this state and said, what did you get for that? They usually got tyranny and a removal of our constitutional rights. And I'm here to plead that nothing is for free. Neither is our freedom. It all has to be fought for and won. And what's happened in the last 3 years in these counties in Northwest Michigan was an abomination to our God-given rights. So I'm encouraging you folks not to accept any more freebies, because everything comes with a price. Thank you.
Thank you. Anyone else like to address the board here?
I'm Bob Wiley from Emmett County. And I agree with the last two speakers that nothing that comes that looks free, it looks good. There's almost always hidden strings, and eventually you take these free things the first time, the second time, the third time, and then it becomes a habit. And if somehow this was designed, a grant to return individual responsibility, and that people can actually live without getting outside help from the federal government or the state government or some, I think this particular CareQuest comes out of Massachusetts. I could be wrong on that, but like John Swarthout, I haven't had a whole long time to review this, but it appears that they want to come and help us. And I'm you know, it's sort of like the old joke, we're from the federal government, we're here to help. Yeah, good luck.
Anyone else like to address the board? Seeing none, close public comment. Next on our agenda is the Tobacco Free Michigan mini grant review. Dan, did you want to start out here?
Yeah, this is, and first of all, and, appreciate everybody coming together at the last minute. We had these things come up, and both of these grant opportunities, with short deadlines, so appreciate everybody making time to make it here. We have a couple, commissioners sitting in for other ones that are, a regular part of the committee, so appreciate you doing that. Yeah, so, I know you haven't had a whole lot of time to review this information. The application for the Tobacco Free Michigan grant just goes along with their mission to increase awareness of, in our mission too, to increase awareness of electronic nicotine devices, or potentially reduce the impact of tobacco that tobacco has on communities. And really, we don't. The way that this funding would work, it's $5,000 and be split up between 3 schools. So we're not talking about a large pot of money. But basically through RISE, which is our coalition, the Otsego Substance Free Coalition. These are schools in Otsego County. This would go to the youth group there in those schools. It's adult-led, youth-focused, youth groups that our staff here, the health department, help lead to come up with a project where they could use these funds to meet the goals of this grant. So it could be, for instance, just as an example, maybe they have a problem with, kids using vapes in the bathrooms at schools. So this money could be used, if they identify that, if the students identify that that's the issue, they could potentially use this money to purchase vape detectors to put in the schools or put in the bathrooms. That's just an example. So I can't tell you exactly what this funding will be used for, other than that it's going to be used to fund a youth-led project to address tobacco in the school system, in that particular school system.
Each Jordan has those detectors now. They work, that picks up the pace, but have they done, I'm pretty sure there was a study done, I think, of Maine's rise in vape usage among minors is in our area.
Yeah, there's a huge increase. I mean, there's combustibles and then there's vaping, and there's definitely a much larger increase in the usage of, electronic nicotine devices. They're available everywhere, right? And problem is in Michigan, we don't have tobacco retailers are not required to be licensed. So there's really no, very little penalty for them if they sell it to a land, so to speak. So there's not an office in the state that regulates them or checks them. The FDA occasionally will do tobacco retailer checks, and Michigan is basically at the bottom of the list in the entire country as far as failing at preventing sales to youth. So Susan Pulaski and Ellen Templeton, who work with the RISE program here, they have, if you have any, other questions, they can answer those. But and if I'm missing something or if I say something incorrect, then I'll expect them to correct what I said. But that's basically, the gist of this particular thing.
Questions?
I don't have questions for that. I do have some comments. But I guess we would have to wait until we vote.
Well, we can have discussion before, we can have discussion after.
It'd be good to have it before, but if you've got questions. we can have questions.
Okay. I guess one question I had is, why does this grant have to go to the health department instead of going straight to RISE? Why?
Well, so RISE coalition that we have health department staff members are basically. So it is going to RISE, but the health department is the fiduciary for
Kind of
RISE.
safe, right?
Yes,
Yeah, safe, exactly.
they're not nonprofits. They don't stand alone. They don't have nonprofit status.
Any other comments or?
Oh, yes, take a minute. Unfortunately, I loaned a book, out. I'd like to use as an example. I don't have that. I have, one of many that was written on Bishop Farragut. He started out as a priest, pretty much, solo in northern Michigan, he walked over 60,000 miles. And, this is alcohol, but it pertains to the same issues. And I don't question your sincerity with your programs. I know your intent is there to solve the problem. I don't doubt that at all. But the problem is, oftentimes, yes, these kids get into it in their early teens, or they get into it perhaps after they've left high school when they've gone on to the college campuses. I've experienced it with my own kids to some degree, some of them. And so Bishop Farragut came into northern Michigan, I believe, in the early 1830s. And he met up with a bunch of drunk Indians. And he was always upset at the fur traders because they took advantage of the Indians by giving them their booze, which obviously they had no experience with prior to our coming to the country. And I don't know what, he was never able to really chase them out of the villages. But by the time of his death in 1868, and this is why I wish I had the right book, his cure rate to alcoholism among the Indians was phenomenal. It was well over 50%, maybe 70, 80%. He didn't do it with social programs. He certainly had a love for the Indians, for the person, for the soul. And so it was through his Christian principles that he was and the man, I don't even know how he did it up until about the late 40s, the early 50s. Then you started bringing in the mining communities into the UP. And so he finally got to see a few more white folk in those days after the 1850s. How he found enough time to do this is beyond me. But he didn't do it through any social program. These programs have been used, not your program, not this particular program. We've had programs trying to stop the use of marijuana. I mean, now we're encouraging that. And as far as tobacco goes, I do recall we have in the past and probably still do presently support farmers selling tobacco, growing tobacco. And so on one hand, the government is subsidizing the farmers. And on the other end, we're trying to save the children with what seems like a small amount of money, and it's only in the one county. But these programs go on or have gone on in the past and will go on in the future. I say the nature, human nature needs to turn to the spiritual before it can resolve so many of these issues. And that is perfect in itself. That's pretty much it.
Okay. So you're looking for a motion to move forward with this, or?
Yes, I mean, we would like to apply for this grant. I mean, it's, the due date's coming up next week. It's a simple application. It's really pretty straightforward. You know, I think it would be, you know, we believe it would be beneficial. It meets the mission of the health department, and, you know, to Commissioner Mason's points, and I'm a fan of Bishop Barriga myself. I grew up in, well, my early childhood in Manistee. Both my parents grew up in Manistee. You know, goes back to the late 1800s. The Bishop Barriga's Shrine is on the north end of Indian Lake in that town. So very familiar with his missionary work and whatnot. And I would just say, you know, the health department, you know, not taking away from any spiritual side of things, because that plays an important role. But, you know, the health department, we have a mandate to try to prevent disease, prolong life. And that's entirely, you know, why we're here. And this fits within that mandate, it fits within that mission. So I mean, that's why we bring these to you. This is why we try to do these programs, because we don't look at ourselves, we don't look at ourselves as socialists, or we're just trying to do a job. We're trying to help people, we're trying to, you know, help people be healthier. You know, that's, I mean, really it. So but I think this is a good, you know, it's a good opportunity. It is, you know, it's not a huge amount of money, but I think it would help the kids in these schools, hopefully. That's our goal, you know, help them, you know, maybe inform them about the dangers of getting into these electronic nicotine devices, or just the impact that tobacco has on communities. You know, that's really what the purpose of this would be.
I think it's neat because money is, they're spending the ideas on the kids. Giving their views, that's what's kind of neat. It's not adults saying, it's finding this group of kids to rise and say, and going to them saying, hey, what are your ideas to help stop this? And the other thing is, it's not just tobacco. At least please, you put THC stuff in them, and look at the drugs that are there. So stop doing this. I know the SAVE program is to make sure. I got 3 kids in high school, let them smoke or drink or do drugs, because they have posters. I don't know if you've ever been in your school. Poster that has the athletes and other people who sign up to the school program.
I guess my fear is that in the past, I don't know, probably 20 years now, we've had problems with drugs and alcohol. And we keep coming up with social programs to try to eliminate them, reduce them, whatever we can. And the problem keeps getting worse. So my feeling is that throwing more money at the problem, getting another grant is not going to solve the problem. I think we need to try something different, but that's just my own thought.
Well, I could say, I mean, one thing, you know, with public health, this is always the hardest thing, right? Prevention is very difficult to measure, right? I mean, I get what you're saying, because, you know, we still have a lot of problems with addiction and tobacco use and alcohol use and drug use, but if we weren't doing these things, would it be worse, right? There's no way to know that, because you can't measure it, you cannot measure prevention. It's, you know, very difficult. So, which, you know, I hear what you're saying, but I think that doing these type of programs, I mean, even if you're helping a couple kids, you know, it's worth it, I think.
Oh, does anybody want to make a motion or?
Make a motion. To. I guess are we approving this? Because we can't go to the board, right, or make the recommendation?
Make the recommendation, so the motion would be to make the recommendation to the full board to approve, the application for the grant. So because this application is due next week and our full board meeting is until September 5th. Basically, we would apply, we could always rescind the application. You know, it's a simple application, you don't have to spend a lot of time doing it. But that's what we do.
Okay, and I'll make a motion to recommend we take this to the board. Okay.
To apply for.
Oh, and apply for the sample free Michigan grant.
There you go. You want to write it down?
Yeah. You want to restate that?
No, I think it's fine.
That's why we have the yellow pads.
We're doing a separate page, no.
Confuse me or yourself.
Yeah.
Yes, please.
Okay, I'd like to make a motion to recommend the tobacco free Michigan grant.
Is there support? There's no support, then the motion dies. Okay, I guess we move on to the next grant then.
All right, so,
Parent Quest.
yeah, and actually, I'll just,
Yeah.
talk about this one. This one came up even quicker. As you know, we just added this to the agenda, so, and how we know more about this.
Sure.
Let her explain this.
Thank you. So as Dan said, this came in the last few days to us, and Dawn Marie Strail, who is our oral health coordinator. She is a one-man show that does a lot of prevention work out in the community. And what this grant's intent would be is to place in contract with a registered dental hygienist to really offset some of the work that Dawn Marie does day in and day out. So we currently we perform sealants, dental sealants, which, you know, if there's any signs of decay and different things, Dawn Marie is able to put a sealant on a child right then and there and really prevent that tooth from, you know, having to get pulled eventually if they can't get into the dentist right away or they don't have access to the dentist right away. I'm sure as Commissioner Rubik knows, getting into a dentist is not easy here in Northern Michigan. At Dental Clinics North right now, we're scheduling new patients out 6 months to a year. And that is just not the best for the populations that we serve. So really what this would aim to do is to help Dawn Marie get to more children within the school system, to be able to put these sealants on children to prevent further cost and dental procedures in the future. So this grant is for an area that has, well, this grant, they have a component of a rural nature. So since we're obviously rural in northern Michigan, we are eligible to apply for this funding. And that is what it would be used for, is to contract with a registered dental hygienist to be able to perform similar of this.
And I see in here that it's for, maybe you mentioned this already, for Gaylord and Mansalona. Is that the plan? or-
Yeah, so it would be that we would contract 1 day a week for someone to go to the Gaylord Blue Devil Wellness Center, into the Ironman Health Center in Mansalona, and then potentially in the other schools where we already have a school nurse. So there's a big push right now, that we know that physical well-being and mental well-being and oral well-being really all tie together. I'm not sure if you've been to the dentist lately, but now they're taking your blood pressure. They're asking you all sorts of different questions, and they're really trying to interconnect those services.
Have you heard anything of, something more recently, some information given to me yesterday, that there's, some intention to encourage that physicians, I'm sure dentists would be part of that, there may be some governmental influence at higher levels to bring them into the more populated areas, drawing them out of their smaller communities they serve. Have you heard anything on that?
Sure, so I am part of the Michigan Oral Health Coalition that does, some advocacy type work, and we're considered to be a dental provider shortage area. So we have that designation. And what that allows us to do is to apply for some special funding mechanisms to, especially with dental clinics north, to bring, dentists and now going to be dental therapists and registered dental hygienists into the area. But that's really difficult to do, even with some, extra funding or maybe student loan repayment, things like that. So this is specifically to be in schools and would be just prevention focused with the sealants, so that we can prolong, the time that they have to get to the dentist isn't as urgent because we can't see them. But yes, that is one of the things that I've heard about and somewhat participated in, is trying to encourage dental professionals to move to the area, just like medical professionals, nurses, doctors.
Commissioner Mason, the way it sounded like that, you said that there was government involvement to get them to move to larger cities?
Yes.
So what
Oh,
Holly's,
I'm sorry.
yeah, what Holly's talking
If I
about.
can complete out-
Yeah, what Holly's talking about is completely separate, because we, like she said, we're a rural area, it's very difficult to get providers to come to a rural area. Well, there's a lot of considerations, right? They don't maybe make as much money, or, there's just certain things about the area, they want to be in a metropolitan area or whatever. So like she was talking about, I have not heard about what you're talking about at all. Like, that would be not good for us.
I picked that information up from James Flynn, a former attorney, retired attorney.
Okay.
And the concern would be, in this case, I question again, you're competing with the private sector and paying very good wages to bring these dentists on board. And it's pretty tempting for a dentist to give up the private practice to come to work for the state, for the health department. In being paid, I believe in the private sector first in these instances. We're robbing Peter to pay Paul, in a sense. So I question that.
Well, I would, oh, sorry. I hear what you're saying, and I believe in free markets too. I believe in capitalism, free markets, all of that. But the patients that we see are not patients that private dentists typically see. And I'll just say that straight up. 80% of our patients are Medicaid, probably more. And we just don't see, I mean, private dentists just do not, see those patients. So, I mean, we're filling a niche to see the underserved, which is why health departments exist. A big part of why health departments exist is to see the underinsured and uninsured. In those particular population groups, and I would, there's data out there, that we can provide regarding those numbers, if you want to see it. But that's, we are not competing with private dentists as far as that goes. Now, as far as like, if we have a job opening, I mean, it's a free market, right? We want to hire a dentist. I we can't control where they're coming from or who's applying or whatever. I mean, but I guess I don't know, how to solve that problem. If somebody decides, I mean, there may be a whole host of reasons why they decide not to have a private practice anymore, but I think dentists that have private practices probably would, make a lot more money doing that, running their own business and a private practice that they would come and work for dental clinics for. But we have to be competitive in the market too, to attract dentists.
I think that it's important too, to realize that even, whether private or, the public sector, is that we still don't have enough to go around. So even, dentists that are working in their private practice, sometimes they have to refer them to Dental Clinics North and vice versa, because we can't see that person, because as a region, we just don't have enough. So I think that's part of it too. And usually these registered dental hygienists that we contract with, they're retired, they've worked in private practice all their lives, and now they want to give back to the community. They want to go into schools and put sealants on children or do something like that. So I don't feel like we're taking away from the workforce necessarily at the private or the public sector, but that this is, more of a service that hygienists typically perform in their retirement.
What you mentioned is actually what happened to me last year. Health department had an opening for a dentist. And my dentist, that my wife likes, and our 6 kids from East Jordan, had her practice right on the same street where Josh has a store, closed her practice down and went to work for the health department. And now she's in Gaylord. And my wife says, I can't take the kids to Gaylord. It's just too far to go for a dentist. So now we have a dentist who has left the private and has gone to work for the health department 28 hours a week. It's full time with full benefits. And we don't have the dentist we like anymore.
I know, I won't comment and say anything, but that it wasn't because of the health department. You can talk to her, I talked to her neighbor. I don't want to get into that personal thing, but it wasn't because of what the health department offered. It was a totally different reason.
Well,
And I'm gonna leave it at that. You can go ask for yourself.
One thing that, and you, Dan, had mentioned, the other day that the dental practices. That, in fact, it was more a side note. You mentioned the, cost of the equipment down the road, as it ages, has to be replaced, which is going to be very costly. My own dentist has mentioned one of the machines that he purchased for the molding of caps, I think, I think he paid just a couple of years ago, he paid $60,000 or $70,000, something in that area, just for that piece of equipment. And it's already becoming obsolete. Not that it's good for years to come, I'm sure it will serve its purpose. But those dentists in the private sector are obviously investing themselves. And so their profits are not always as great as we may think. They may do well, but they need to bring in an awful lot of money in the private sector to be able to perform what you do, where grants pay for the equipment. Or who pays for that?
Grants don't pay, it's
They do that themselves through their, okay,
through the revenue that's generated.
okay.
I have,
Just like a, a private practice, we have to take some of that revenue and reinvest it into the facility, right? To keep up with the equipment, maintain the facilities and whatnot.
I have a question about this. I had an older gentleman that pulled me aside in one of my meetings. He was a county commissioner for Grand Traverse County for 6 or 8 years. And he said, Mr. Rubin, he said, be really careful of ever voting to approve a grant that hires a person when it's only for a year or two. Because what are you gonna do when the year or two is up?
I'm so glad.
Where's that gonna come from? So I asked that question.
I'm glad you said that. I really am. And here's why. Dan and I had that discussion this morning. And it wasn't about this because we're not hiring a new person. But that's always the question is after you hire somebody new and it's only temporary, even if you tell them up front and you say, look, after a year, we have no more funding, you have to go. You know what happens? They're so wonderful and we just can't live without them and we have to have them. And so this is a concern that every finance director who's worth their salt should be asking the same question. So yes, that's a valid point. In this case, we're not hiring anybody to our team. It's just somebody temporary, like Holly said, it would be a retired type situation. They're not looking for full time, but yeah, it's a contract. So, but I'm glad you keep that in mind.
The other thing is this. I guess it's CareQuest. The second paragraph down, I think it might have even been brought up in public comment. Since our grassroots engagement initiative in 2015 to 2020, we've continued to elevate new partner voices to reshape, disrupt, and transform our oral health system. There is nothing in that sentence that I agree with. In fact, I'm opposed to it. Why would we want to disrupt a system? Can we work to make it better? Sure, but to disrupt it, there's parts of it that work really well. There's always room for improvement, but
Yeah, I don't know what that means. So,
I don't either.
right.
That's what we're doing right now. I saw that same thing, disruption.
Henry, it's on this page.
That's, I mean, I've seen it, I know what you're talking about it. Pages not showing up.
Well, all I can say is, I know there are certain things, and I've heard it before, when you're looking at the RFP with a funder, that we're going to and saying, will you give us this money to do this project when we put up these RFPs? I mean, I know that some of you have voiced that you have issues with who they are, what they do, but that's not what we're looking at it for. We're looking at it for, a source of funding to do a project that we're doing locally. We're not vetting them or, saying they have to meet a certain criteria. I mean, we just want to do the project that we want to do to help it. So, I mean, I guess that's all I have to say about that, but
I would say that language is rather radical, and it's
I
not
don't-
your word, it's in.
I would like more context to it before I would say radical. I don't know what it means, I mean,
It seems to be the language that's coming out more and more commonly, and that it's like training sessions or teaching this kind of thing. People would like to say there was disruption in Washington DC and everything since there's been disruption. And now we're talking disruption, using that word here, and I suppose you're right. Maybe you don't want it to mean what it says, But somebody perhaps has that intent and plants the seed. And that becomes a part of normalizing.
It's a really bad choice of words.
Yeah,
I take it.
I think they probably, whoever did this somewhere way up the line is fairly comfortable with that choice of words. Something slipped out, they put it in print.
This thing just focused on children too, right?
Right.
Well, I can say I was fortunate enough, I was raised. My family could afford seals and still they have no cavities, so doing seals works, it helps.
Whoops.
So.
What'd you say?
I know, it doesn't like sealing.
We've done 2,300 today.
Yeah. And it helps, and man, years ago, I watched episode, it was called United States of America on the History Channel, and it was amazing how they showed that proper dental care can increase your living by 7 years. That was pretty amazing, just by brushing your teeth and flossing.
Oh, yeah.
That was just amazing. I just always remember that. I don't know why,
And that's why dental clinics North was formed, is because there were so many children that were not receiving any dental care, that the private practices, they couldn't contain the caseload, the patient load. It was too many for them to see. So they were on board with creating dental clinics North that could, you know, take some of that burden off them so they could provide great dentistry as well as the nonprofit.
How did we survive the 40s, 50s, 60s with the population explosion, huge family growth? I wonder, did we do a lot of dental care at that time? It must have been more what was necessary.
It was less sugar.
Pardon me, less sugar, less sugar in the diet, that's
Yes.
true.
Sugar is in everything.
Because we had more population then than we have now. I mean, as far as growth, other than coming into the country through the, across the borders and so on. What's the percentage, 1.7 or? Is the growth, is the,
Oh, you mean,
Average
you're talking
family
like
size.
birth rate?
right,
There was a higher birth rate at that time.
Yes.
Yeah, I agree.
and how did we handle it? We had not the technology we have today. It took more time to take care of the teeth. We didn't even have air conditioning. I remember sitting in an office as a little guy, maybe 7, 8 years old. And I don't know what care I needed for my teeth those days, I don't recall, but. We got through that. How did we get through that? And now we're having this problem.
There were a number of people back then who died without a lot of teeth in their mouth. Both my grandparents had full sets of dentures. Just didn't have any tooth, and they went bad to pull them. We take care of it now, we learned.
Yeah, or they had an infection from an abscess tooth and died of endocarditis, infection of the heart, or they told them there wasn't a lot of restorative care, and a lot of people, frankly, I don't think went to the dentist.
Well, like Josh said, it increased 7 years to life expectancy. That is a true stat. And life expectancy was lower, you know, in the 40s and 50s.
It was.
It just was, yeah. I mean, and I know, I mean, this is totally anecdotal, but from my own experience, my parents, you know, grew up in the UP and Manistee. They were poor as dirt, you know, they didn't go to the dentist when they were kids. And, you know, my dad got out of college at Lake State, went down to work at Flint for GM. And all of a sudden we had dental insurance. And I remember she went to the dentist, like she had a standing appointment like once a week to get her teeth fixed, you know, because they were so bad. So,
He had dental problems too back in the day.
yeah, I'm sure he did. Yeah. Yeah. So. I mean, we definitely don't have the extent of problem problems they did back then, that's for sure, but, you know, we just try to stay on top of it, you know. And provide care, because we have a different, you know, we want to make sure people are set up for success, especially, you know, dealing with kids.
Is this program underway now? Without, you know, are we just trying to expand it?
Yeah, that's what it would be, is really trying to reach more children. So we, yeah, it's called SEAL Michigan, and that's the sealant program. And
That's the current program.
Yep.
So, yeah,
and it just doesn't provide a whole lot of funding, and Dungaree's one person and can't get everywhere, so this would be an extension of that.
But Dental Clinics North recently has done pretty well.
This is separate, some type of, sorry, this has nothing to
This is only for the health department, or?
right.
do, right?
Okay,
I would die 3 times over for that. If I were here at 1850. I mean, a lot of deaths, early deaths weren't just demolitions.
Oh, yeah.
One thing they knew back then, and we've abandoned, is again, getting into natural health, is parasitic cleanses. And I used natural antibiotics, and when I had a terrible cut in my arm, I did not use any of the antibiotics that were prescribed to me. I used garlic and cayenne pepper in my diet every day for 2 weeks. Went back to the doctor, pulled the stitches, he said, you took my advice, picked up the prescription for the antibiotics. I said, no. Garlic and cayenne pepper. These things are, look them up in the health books, you'll find it. You gotta get the right books.
Yeah.
I guess for me, I have a number of constituents that are sick and tired of this kind of language, and page 3, it says seeks to advance local, state, or federal policy or systems change. I have a whole bunch of constituents that aren't happy with federal policy, state policy. I guess they always say follow the money, and this money is going through this organization, so I can't go for this. But if any one of you guys wants to make a motion,
Better write it down, right? I'll make a motion to recommend a care request institute grant.
their support. If not, motion dies. And I don't see anything further on our agenda. So I will call us adjourned at 2:50.
Before you guys leave, at least for Darius and Josh, we have putting together that meeting for the 29th to go over the grant review policy. Would you prefer morning or afternoon? Do you have a preference?
I think I can make either one.
The Friday, it's.
No, I think
I'm
it's
in
a
2024.
It's the 29th, I believe, wasn't it?
No,
What day of the week?
on a Tuesday. That's on 2024.
Well, it's third, oh, it is Tuesday. Never mind.
Yeah, I don't believe I have anything. On that day.
September?
August.
August. But I think, Don,
Thanks.
yeah, he said that he would be able to. Yeah, I kind of know his schedule. I was just, yeah. And I think, Commissioner Turnbull also said that he would be available. So.
We'll have our regular. Force them back.
Right.
All right, so I guess whatever works best for you.
Either morning or afternoon, doesn't matter.
Doesn't seem to matter to Josh or I, so,
Okay, we'll put something out.
yeah, just. Maybe even this week, just so I can get
Yeah.
on in case something else comes up.
Yep.
That would be helpful for me anyway.
Okay, understand. All right, we'll do that.